All righty. All right. So let's talk about the adrenal glands. Now, we first were introduced to the adrenal glands back in lab, back in 2010. All right. We saw that they were these two kind of, well, the models looked like they were kind of peach-colored or tan-colored or tissue that sits right on top of each kidney. Now, this term up here, retroperitoneal, this is very important that you understand, all right, this term, retroperitoneal, because one, if you're going to go into the medical profession, and especially if you're going to be dealing in a first responder capacity, certain tissues and organs are retroperitoneum. Does anyone remember what the peritoneum is? Well, right. It's a space inside your abdomen. All right, but we refer to, remember the serous membranes. Remember there's 4 types of membranes in your body: cutaneous membrane, mucous membrane, synovial membrane. All right, and then we have serous membranes. And serous membranes are 2 layers. You have a visceral layer and a parietal layer. The visceral layer lines the organs directly, and the parietal layer usually is going to line the internal cavity. Anyways, so retro means behind. So the kidneys actually sit behind the peritoneum, which is important. It just means they're more posterior. All right. So if someone presents to you, if you're going in the medical profession and they're complaining, this is often, I see, this is quite common. I see this with patients that will come in complaining of low back pain. All right. But no matter what they do, they cannot get relief. You know, they sit, stand, whatever, they roll over. In most cases, people will get some sort of relief. What they're having an issue with is kidney stones. Not every time. All right. And there's actually an orthopedic test, and it's kind of barbaric, but you have the patient sit up. All right. And it's called the Murphy punch test. And you literally punch them, all right, not like full-blown punch, but you give them a forceful kind of hit right over where the kidney is. And if they jump up, all right, then it's a positive for that test and some sort of kidney pathology. And the reason why you hit them in the back is because it's retroperitoneal, but also you're jostling the kidney around. So if there's some sort of itis, infection, let's say, or irritation of the kidney, it'll irritate it, so you know that there's something going on.
How would you not jump?
Well, again, it's not, I can't really demonstrate it, but I mean, I'm not going to go just like punch them. It's kind of like a, you know, kind of thing. Now, that's still not going to feel great, but if they're literally just like, oh, you know, coming off the exam table, then you know, all right, that there's definitely a kidney pathology going on. Because here's the thing, the kidney is sitting in a big glob of fat. All right, remember some of the functions of fat? Insulation, cushioning in this case. So these kidneys are embedded in this fat and also some fascia, which is a connective tissue. All right, so there is some protection going on there. But going back to the adrenal glands, there's 2 parts to the adrenal gland that we're going to really focus on physiologically. One is the internal portion, or the core. All right, that's the medulla. Okay, and then the other part is the cortex here. So it's really kind of easy to remember. Well, I'll go over that in a second here. All right. So the inner portion is the adrenal medulla. All right, and it's going to have this red-brown color. The red hue mainly comes from the amount of blood vessels that are present there. All right, and it produces, real easy, 2 hormones. Okay, norepinephrine and epinephrine. Now it's important because we already saw that it's innervated by sympathetic stimulation, and most importantly, that the neuron, it's a single neuron that stimulates your adrenal glands, meaning when the neuron exits the spinal cord, it doesn't synapse anywhere until it gets to the adrenal medulla, which is important because remember, a synapse slows the signal down. Okay, so if there's no synapse, there's not going to be any slowing down of the signal, and you think that's going to be important, especially in a fight or flight response. You're getting chased by something, and you've got to get that norepinephrine and epinephrine into your bloodstream. We don't have to wait now for an electrical signal to be converted into a chemical signal back to an electrical signal in a synapse. There is no synapse involved. Right there to the neurosecretory cells in the adrenal medulla, we start pumping out epinephrine and norepinephrine. So those are the 2 hormones, real easy to remember. All right, those are another name for that classification of these 2 hormones is called catecholamines. Right, I don't know if you remember that, but that is a classification for neurotransmitters. Are the catecholamines. All right, then the other portion of the adrenal gland is the cortex. This is the outer portion there. Okay, and it's mainly yellow, Again, if things are yellow, it's going to have a high fat content. And there's 3 regions to this, okay? So the outer region is called the zona glomerulosa. All right, the middle region is the zona fasciculata, and then our innermost region is the zona reticularis. So that's going to be G, F, R. All right, G for glomerulosa, F for fasciculata, and R for reticularis. There's also, and we'll revisit this here, GFR also stands for glomerular filtration rate, and that's something we're going to learn about when we go over the urinary system and how the kidneys filter out, all right, our blood and our filtrate, what's called stuff that we drain from the blood, all right? But that's how I remembered the order of glomerulosa, fasciculata, and reticularis. I just remembered GFR, okay? All right. So, and of course, the cortex is going to produce all those different steroids. So if you want to pull out your atlas, because again, I've embedded some of the atlas slides into the, I hate to call this a lecture presentation, but this PowerPoint presentation. All right. So here we can see the adrenal gland. All right. The inner portion on our model here looks blue, but that should technically be, all right, like a reddish brown, but for our purposes here, that inner portion, that's the adrenal medulla. All right, and then surrounding that, this yellowish orange, all right, layer, that's going to be the adrenal cortex. And then this thin kind of reddish, all right, covering is the capsule. Can anyone guess, all right, what the capsule, what kind of connective tissue the capsule is made out of? Let me give you a hint or help you out. Capsule is going to be somewhat of a protective covering, all right? So it's not cartilage or bone or any of that stuff, okay? So obviously, all right, but the capsule is going to be a type of connective tissue that can resist multi-directional stresses. It's pretty hardy. What would you say? There you go. Dense irregular connective tissue, okay? Dense irregular connective tissue. Most organs that have a capsule that surround them are going to, that capsule is usually made up of dense irregular. When it's dense regular connective tissue, think tendons and ligaments, all right, for the most part, okay? All right, booyah. Here's the adrenal gland location. You can see, let me get my pointer here. Here's the kidney, all right, and it sits right on top, okay? You can see it here. There's one adrenal gland, there's the other. All right, so now what we're going to do is we're going to go over this in a second here. All right, so now we're going to take a histological slice, all right, right out of our adrenal gland, all right, to display all the different layers here. I want to zoom in on this. Okay, so we've taken our slice here, and you can see this is an actual drawing of this drawing. Here's the capsule on the outside. Our first layer, remember, GFR, okay, glomerular filtration rate, or zona glomerulosa, all right, zona fasciculata, there's our middle layer. Then our innermost layer of the capsule, of the cortex, is the zona reticularis. And then deep down inside is the adrenal medulla, okay? So now you can actually see an actual histological slide here. So here's the capsule out here. All right, here's the glomerulosa, this kind of dark stained purple area. And this lighter stained purple area, that's the fasciculata. And the innermost layer is the reticularis. And then that looks blue to me. Pardon? Is it upside down? Yeah. All right. Yeah, please don't get that confused. Make sure you write that on there. Yeah. Let me show you. There we go. There you go. All right. So yeah, it is upside down. So down here, number 5, that's the capsule. Okay. And the color on this isn't the best, but where this bracket is right here, there's your glomerulosa. Okay. And then you can see the fasciculata in the middle, and this darker brownish reddish area. All right. That is going to be the reticularis, and then the inside here is going to be the adrenal medulla. I'll give you a second to copy that down. All right, and then we're going to talk. And the nice thing is about talking about this a little bit in lab, we'll review it in lecture, so you kind of get you're double dipping, sort of. And we're going to talk about some of the hormones that are produced in these layers here, okay? And has anyone had a chance to look at the soft chalk lessons, the drag and drop exercises? Real easy, you know, and again, I highly encourage you guys to, sorry, that's the New Yorker in me, you folks to pre-label before you come to class. It just makes it a little bit easier there for you, you know. Good, I'm glad. I really do like that. And well, I shouldn't say last semester, but in 210, I do a lab preparation on Connect, which is like the drag and drop exercises. So it just somewhat helps. And again, pardon? Did it?
Yeah. Like such and such.
I didn't notice that until
Well, as long as it helped, that was the important part. I mean, yeah. Ideally, those exercises are there to help you guys.
Oh yeah, it would say like identify this bone. It would say like how I want.
Yeah.
Humorous. What is this bone? And you're like, oh, humorous. Okay.
It's like the question is what was the color of George Washington's white horse? Kind of thing. There you go. There you go. All right. So let's talk about the adrenal glands. Specifically, let's talk about the cortex there, okay? All right. Our cortex is going to be that portion of the adrenal gland that's going to secrete the corticosteroids, okay? So we're going to talk now, all right, about the outermost layer, all right? So the glomerulosa, okay? We're referring to our mineral corticoids, excuse me, okay? So think of mineral. If your doctor ever asks you, hey, are you taking any vitamins or minerals? You should start to think, all right, minerals, what are some examples of minerals? Magnesium, all right, calcium, zinc, all those ions that we were kind of discussing. So that can help lead you into electrolytes, okay? So mineral corticoids, all right, are going to help regulate the electrolytes in your body. Does anyone know the definition of an electrolyte? It's okay if you don't. Electrolytes are a substance that can conduct electricity, believe it or not, hence electro, okay? So electrolytes are going to be the things that can conduct electricity. Now, I don't want you to think of all the things that can conduct electricity in your body, but when we were learning about the nervous system that has to do with electricity, what were some of the things we were talking about? Some of the ions. Salt, which is what? What's it made up of? Sodium, chloride, potassium, calcium, magnesium, all those are considered electrolytes. So all the stuff that when you get your blood taken and you look at the blood readout and you're like, oh, magnesium levels, sodium levels, those are considered electrolytes, okay? So that's what these mineral corticoids are going to help regulate, all right? Specifically aldosterone, all right? This guy here has to do with sodium and potassium. And it's going to help to retain, all right, sodium, meaning you're not peeing out sodium. What loves to follow sodium around? Water, booyah. Sodium chloride, salt, all right? So water likes to follow sodium around. You're going to find out when we get into the kidneys too, so kind of put this in your brain now. We'll talk more about it. Water also loves to follow glucose around. So think about it. Someone that's diabetic, all right, what's one of their complaints? Pee all the time. But also, if we were to do a urine dipstick on them, what do we find in their urine? Well, protein, but glucose. You'll find both. But you'll find glucose. Water follows the glucose. That's why they're peeing all the time. Okay? So, it's a long explanation. But aldosterone is going to retain sodium, but at the same time, it's going to get rid of, all right, our potassium. Okay? All right. So in the middle layer, okay, in the fasciculata, all right, this is where we have our glucocorticoids, all right? These guys, think of glucose, sugar, help to regulate your blood sugar levels. Stress hormone. Number one stress hormone in your body is cortisol, all right? A lot of you are producing it when you come around test time, All right, a lot of us produce it just in general because we lead very stressful lives. It's not good, all right, because cortisol suppresses other hormone levels, insulin, for example, growth hormone, for example. That's not good. So you want to keep your cortisol levels in check. Cortisol is going to increase blood sugar levels. What decreases blood sugar levels? What enzyme? What hormone? Insulin. So cortisol and insulin are antagonistic of one another. All right? Insulin and glucagon are antagonistic of one another. We'll talk about glucagon later on, okay? All right, and then finally, our gonadotropins, all right, or not tropins, excuse me, gonadochloroids, all right, gonad sex hormones, all right? So these guys are found in the innermost layer here in the reticularis, all right? And not a lot of people know this, but the androgens, all right, we briefly talk about it in 210, all right, but androgens are male sex hormones, okay? And now, for the majority of the male testosterone is made in the testes, but some, all right, is made here in the adrenal glands here, all right? The difference is, all right, in women, all right, your body converts it into estrogen, okay? So you too, all right, not just the ovaries that produce estrogen, but you too, all right, the zona reticularis is going to produce some sex hormones, all right? Except in your situation, okay, your androgens get converted into estrogen. Now, if you are missing an enzyme, all right, that impacts the conversion of that, then you're going to have an increase in male sex hormones, testosterone levels, all right? And there's conditions like hirsutism. Has anyone ever heard of hirsutism? All right, that's when women have an increased release of androgens. That's where we first talked about this, all right? And they'll have some male characteristics, some hair growing on the face, not like the bearded lady or anything like that, all right? And it can also mess up the menstrual cycle. So anyways, all right, pancreas. Okay, let's talk about the pancreas. Every time I eat a Krispy Kreme donut, I think of the pancreas because my 4 beta cells are getting beat up, all right, from all my blood sugar, okay? So where is it located? I was actually going over this with some students last night. All right, your pancreas is going to be inferior to the stomach, and it's sandwiched in between the spleen and the duodenum, which is the first part of your small intestine. But it's like right here in the middle, okay, right in the center there, okay? So it is a gland, all right, that has 2 types. Remember we learned in 210 that you have exocrine glands and endocrine glands. One has ducts, the other does not. We are learning about the endocrine system right now. That's the ductless system. So the pancreas has both exocrine, all right, it has ducts, so exocrine functions and endocrine functions. We're going to talk about both of them. So let's start off with the cells first. The acinar cells, all right, these are the ones that are going to be involved in our exocrine function, all right? They're going to make certain enzymes for digestion. Perfect example, lipase and amylase. Those 2 enzymes help to break down fats and proteins. I'm going to tell you something right now. Proteins are a bear, all right, to digest, all right? So, in fact, when you ingest something of a protein nature and even in fats, you have in your saliva serum amylase and serum lipase too that helps to start breaking down proteins. Your stomach starts to break down those proteins even further, and then your pancreas starts shooting out, all right, these digestive enzymes and starts to break them down even further in the small intestine. So a lot is going on to break these proteins down, okay? So your pancreas has these acinar cells, all right, and they're going to be the ones that are going to be releasing these enzymes, these digestive enzymes, all right? So they make up the majority of the cells in your pancreas. So the majority of your pancreas is going to be exocrine, all right? And these cells will be found in these clusters, all right? And we refer to these clusters as the acini here, okay? I'll show them to you in a second, all right? And then you have these bigger, when I say bigger clusters, all right, these islets of Langerhans, all right, they're just their grouping of cells are just bigger than the acini, but the acini cells or acinar cells outnumber the cells found in the islets of Langerhans. Okay, we call them the islets of Langerhans or pancreatic islets here. Right? So these have our endocrine cells, and this is very important that you know this. All right, these two things are huge. I can almost guarantee you, all right, that will be asked on the lab test. All right, which cell produces what? Beta cells, insulin. Alpha cells are going to be the glucagon. All right, and they're both antagonistic of one another. Okay, so if you know what insulin does, just think insulin, in. It puts stuff into the cells. It'll take it out of the blood and stick it into the cells. Insulin helps to take fatty acids and triglycerides and whatnot out of the bloodstream and stick it into the cells. Insulin helps to decrease blood glucose levels by putting glucose into the cells. Lowers the blood glucose levels. Okay? Glucagon does the opposite. Okay? All right. These delta cells. This term here, believe it or not, somatostatin is an inhibiting, all right, hormone. It inhibits growth hormone. Okay? So these delta cells make that. Okay? Alrighty. Here's a nice picture of our pancreas here. Okay? Here's the spleen. Here's the duodenum in between. There's the pancreas. To me, it looks like a cane on its side here. Okay? So you can see here, I'm going to use the other slide here. Well, let's do the gross anatomy, and then I'll show you the histology of the cells. I like your lab atlas slides better. All right? All right, so here is the spleen. Let me ask you a question. The spleen, is it on the right side of your body or the left side of your body? Left. Which side of your body is your liver? Thank you. Good. All right, I just want to make sure that people know that, because sometimes people get that confused. All right, so liver is going to be on the right, pancreas is on the left. Okay? All right, so here's our spleen. Okay, here's the duodenum or duodenum, all right, however you like to pronounce it. And then in between is the pancreas here. Now, there's different parts to the pancreas. The skinny end down here by the spleen is the tail. The middle portion, again, is going to be the body. And this big thickened area up here that sits and nestles into this curvature here of the first part of the small intestine, the duodenum here, there's the head. Good? If our lab test was just to have that be a piece of cake, right? I think. I'm going to tell you, I can't speak for everybody, but I have a feeling that many of you will be somewhat relieved to know that there's not as many things to identify this semester as compared to last semester. All right? But there's still quite a bit of lecture material to know, okay? And I'll present it to you as best I can. This is the picture that I like, okay? This is in your lab book, okay? So what we're looking at here, all right, is obviously a slide from the pancreas, and you can see all these dark, I don't know what color you would say that is, purplish or whatever, all right? These are all the acinar cells, and they far outnumber, they're smaller clusters, all right? They far outnumber the pancreatic acini, okay? Okay, so these guys, their job is going to be exocrine function. They're going to be making those digestive enzymes, okay? So you can digest that McDonald's meal that you had before you came here, all right? And then here inside this blue circle, all right, that's the islet of Langerhans, okay? And you have two types of cells. The beta cells are much more numerous, all right, than the alpha cells. All right, so the beta cells are these kind of tannish looking cells, and then the alpha cells, all right, are these red staining cells there. Oh wait, that's on the wrong one. Sorry, hold on. I jumped ahead. My bad. There we go. Okay, so you can see the red cells here, all right, are the alpha cells that they make the glucagon. So a question that you could see on the lab exam, easy question, all right? Arrows could be pointing to these red cells here. And the question could say, what do these cells make? And you would say, well, they're alpha cells, but what do the alpha cells make? Glucagon. Right. So please do me a favor. Look on these test questions, all right, to make sure, all right, if it's just an arrow pointing to something, it's a straight up identification, okay? Tell us what it is, all right? But check to see if there's words on the slide, all right? If it says, where does this make? Where is this found? All right? You need to be able to identify it to know what you're looking at, but then you have to answer the question, all right? Don't lose points on that, okay? All right. Am I going back to this one here? All right. Boom. All right. Let's move on to the pineal gland. Pineal gland is one of two structures that make up the epithalamus, which is found in the diencephalon. Okay? So the pineal gland, I think at this point, and I hope you know this, it makes melatonin. All right? And I know I joke around and say that I give it to my kids, and I do. I don't give it regularly. All right? I will be giving it to them tomorrow night when we're driving down to Florida. All right? Because I want them to sleep and shut up so they're not. No, I'm just kidding. Melatonin regulates your sleep-wake cycle, okay, what we call the circadian rhythms, all right, helps to make you a little bit drowsy, okay? But interesting fact here, it's going to affect, all right, the gonadotropin releasing hormone, which is interesting about that, because I read this in a research article not too long ago, that supplementation of melatonin, i.e. giving people melatonin or you yourself taking, well, it doesn't really matter so much for me because I'm much older now, but it can suppress the release, all right, of your sex hormones, all right? So it can cause issues during puberty if you're giving melatonin, a lot of it, all right, to young kids, all right? Again, I'm not saying, I'm not here to lecture anybody, well, technically I am lecturing you, but I'm not here to tell you what to do, all right? But I have a nephew still. He would take Ritalin during the day. He had some learning disabilities, so he had Ritalin during the day, and then at night he took melatonin every day, except in the summertime. That's when most parents take. You know, I'm sorry, I haven't even been reading up on your comments, guys. What's number one? Brittany, I'm so sorry. What's number one pointing to? If that's what you're asking for, Brittany.
Yeah, she said that a while ago.
Oh, I'm so sorry. Oh my gosh, I get to talking. Don't hold that against me, all right? And then Kaylee, you're saying sex hormone, influences what? Oh, you looked in the book. All right, I'm sorry. I am gonna, see, this semester, because the computer screen is here and I'm trying to talk to you folks here, I'm not looking here. So please don't take it the wrong way if I spend a lot of time looking at the screen. And I'm sorry, y'all at home. I feel like I've neglected you. I will not do that anymore. All right, you're all very important to me. All right. So again, this melatonin is going to affect that gonadotropin releasing hormone from the hypothalamus. All right, and it can cause issue with the sex hormone. But and from what I read, it can I don't want to say stunt their growth, but it can affect development during puberty, which is you don't want to mess with any of that stuff.
What happened to him?
Oh, to my nephew. Oh, nothing. Sorry. That was a horrible story to lead into. Nothing. I mean, but my point was, oh no, well, my point for that was, he was being given a stimulant during the day. All right, he's essentially being given, an amphetamine, a stimulant that would get him all, I don't want to say hyper, but then he would have to be drugged at night. So he was in this cycle of, we'll stimulate you in the morning. Is that what was going on with you?
No, I take Ritalin.
Oh.
I take Tryptophan.
Okay.
You see,
Right.
same situation.
Yeah, I have like zero melatonin every night.
Yes.
The what?
I guess the Adderall.
It can. Well, here's the thing. I mean, yes. Yeah.
If you have ADHD, you do the opposite because you actually are already
Right. I used to take Ritalin. It was prescribed. All right, and I hated it. I hated it for me because it made me just anxious. So I had to come off of it and find some other methods, but that was a long time ago. Now I just use it as an excuse, my ADD. So if I'm not paying attention to people in my family, I'm like, oh, that's my ADD. What'd you say? All right. Let's talk about parathyroid glands.
We're sitting back here like talking over each other like.
All right, parathyroid glands. All right, we saw these back in, I was going to say back, not in 210, but on Monday. Those are those purple dots that we were looking at, okay, on the back side of the thyroid. And usually there's 4, all right, and for our lab models, we have 4, but it can be anywhere from 2 to 6, all right? But the big thing, all right, well, we'll talk about what parathyroid glands produce. You have the 2 sets of cells are the chief cells and the oxyphil cells. Now, chief cells, another name for them is principal cells, okay? But they produce that parathyroid hormone. And that parathyroid hormone, all right, we talked about that in chapter 17 when we were talking about our skeletal development. So when blood calcium levels are going to be reduced, all right, parathyroid hormone, all right, gets released. And it works, it's again, here's that synergistic relationship. It works synergistically with vitamin D, okay? Also known as, what's the other name for activated vitamin D? Calcitriol. Yep, calcitriol. Okay, we'll talk about it. I want to say in lecture what's going on with vitamin D, so I don't have to talk about it here. But what it does is it increases the blood calcium levels. So what are some of the ways to increase our blood calcium levels? We learned it last semester. I keep saying last semester. That's to assume that you took 210 last semester. But it helps to, 1, reduce the excretion of calcium in your urine. So your kidneys say, nope, we're not going to excrete any. We're going to absorb it or reabsorb it. So you're not peeing it out. All right. So it's going to make sure that your urine does not get rid of the calcium. It also is going to help, because remember, our bones are a storage site for calcium. Remember, hydroxyapatite, all right, that's what gives bones the hardness, and it's made up of phosphate. It's also made up of calcium. There's some oxygen thrown in there. Well, osteoclasts start to reabsorb the bone, and as it does that, they release enzymes, and that breaks down that hydroxyapatite into calcium and phosphate. So if your calcium and phosphate levels are low, the osteoclast will release that. Where does the calcium go? Into the blood, okay? And it works with calcitriol to help absorb more calcium from your small intestine, okay? So those are the effects of our PTH there. All right, another gland in our body, the thymus gland. If we were to dissect an adult, the thymus gland looks like a small shriveled piece of grizzle, okay? But in a young child and in infants, it's huge, okay? Because the thymus gland, all right, when you're really young, is very active, okay? And its job is it's a safe haven for some of your white blood cells. And we'll talk about this when we get into the immune system here, mainly the T lymphocytes. That's where they go, all right, to grow up, okay? That's where they go to mature, okay? And also, that's where they go to get tested. And I'll get more into the testing process. But these mature lymphocytes have to be tested to know the difference between our what we call self cells, the cells that are supposed to be in your body, and the foreign cells. So they undergo some tests. If they fail the test, they get dumped, they get killed. Boom, okay? That happens in the thymus here, okay? So in childhood, all right, the thymus is nice and big and it grows. But as we transition into adulthood, it shrinks down, okay? And you'll find it, all right, right above the heart there, near the aortic arch there, along with some of the other blood vessels, okay? Another hormone that we're going to talk about here, all right, and basically, and I should have told you this, all right, at this point here in our slideshow, we're now talking about structures in the body that have endocrine function. Remember that one slide that I put up there? You have certain glands that are specific for endocrine only, all right? Like your pituitary gland, that's all it does. All right, your thyroid gland, that's all it does. All right, your adrenals, those are endocrine only. But then we had another part on that slide in which you have structures throughout your body that some of the cells in there and those structures have endocrine function. Liver cells, the pancreas, for example. And now we're going to talk about the heart. Believe it or not, your heart here produces this ANP, which stands for atrial natriuretic peptide, and that that hormone gets produced when there's a lot of pressure on the atria of your heart. Remember, your heart has 4 chambers. The 2 top chambers are called atria. The 2 bottom chambers are called ventricles, in case you haven't. I know we haven't covered that. So if your blood pressure increases or your blood volume increases and there's more blood returning to your heart, it's going to stretch those walls out in the atrium more. So it starts to produce, all right, this ANP, and its response is to decrease your blood pressure. Okay, it's kind of neat. So your heart can actually influence itself, all right, when your blood pressure increases. Okay, so your kidneys are another organ that have endocrine function to them. They're not just solely for filtration of the blood, all right, but they create this guy, erythropoietin, EPO. And erythropoietin helps to stimulate red blood cell production. So if your blood oxygen levels are low, there could be several reasons. You might not have ample hemoglobin, which reminds me. Do we have time? Oh yeah, we got plenty of time. All right. Hemoglobin, I just learned this fact. It's a really cool fact. All right. The only difference between the molecule of hemoglobin and the molecule of chlorophyll, are you familiar with chlorophyll? All right, that's that substance in plants that, pardon? Borophyll. You just said, I just caught you on that one. More like borophyll. Sorry. That's not Happy Gilmore. That's Billy Madison. Thank you. All right. But chlorophyll is that molecule that is utilized in photosynthesis to make plant energy. All right. So the only difference between those 2 molecules at the center of hemoglobin is iron. Fe is the element symbol, and at the center of chlorophyll is magnesium. Just kind of FYI. It's really neat. Anyways, and both are critical for life. You know. All right. So your blood oxygen levels get low for whatever reason. You might have decreased hemoglobin levels. You might have just decreased overall red blood cells that carry the hemoglobin. All right. So your body responds by making more structures that can carry blood oxygen. So what is that? Red blood cell. All right. It will grow more red blood cells. Does anyone here happen to know what the lifespan of a red blood cell is? Bang, you go, girl. 120 days. 120, okay? Should know that. It's a good fact to know, all right? All right, so what EPO does is it helps to increase or make more red blood cells, therefore creating something more to carry oxygen in the blood, okay? That's another negative feedback system. All right, liver. Liver does a lot, y'all. All right, I've never eaten liver, never will. All right, I respect it too much to eat it. No, I'm like Fonzie, I don't like liver. All right, so the liver is going to produce all sorts of fun things. We already saw its role in the fact that it produces insulin-like growth factor 1 and 2. All right, but also it's going to secrete the hormone in its inactive form called angiotensinogen. I'm talking too fast. I got to slow myself down. All right, angiotensinogen. All right, when it's inactivated, all right, not going to do anything. When we activate it, it's got to go to the kidneys to get activated, and it's also got to go to the lungs. It gets converted into what we call angiotensin 2. When it gets converted into angiotensin 2, what it does is it helps to increase your blood pressure. All right. So when your blood pressure gets low, okay, angiotensin 2 helps to increase the blood pressure by 1, causing vasoconstriction. Okay, when you constrict the blood vessels, you're creating more resistance. That's going to increase your blood pressure. right? But also it's going to decrease the urine output. Why do you think that makes a difference? Why do you think decreasing the urine output is going to make a difference in your blood pressure? That's right. Basically, the fluid that makes up the majority of your blood, and we'll talk about it, is water. Okay, so it keeps that fluid in your body, and it'll keep it in the blood vessels to help increase that blood, what we call blood volume.
So is that why, like, you get a lot of blood pressure medications that are a combination of blood pressure medicines and diuretics?
You got it. Yep, that's one of the reasons why. Yep, diuretics or Lasix, is a common one in which I know I shake my head too. All right, and the problem with Lasix is that it causes you pee out potassium, and if you start to pee out too much potassium, your heart gets screwed up. But spironolactone is a good one because that's more of a steroid, and that's a potassium-sparing blood pressure medication. And if we have time, not today, but we'll talk about some of that stuff. So what we will do is we want to make sure that we're retaining as much of that fluid as possible. So we decrease the urine output, making sure that the water stays in your blood. Okay, because we'll learn later on, your your kidneys filter the blood. So if you have too much water, you'll excrete the water into the urine. If you have too little water, you'll retain it. Okay, so keep that in mind. And then obviously, if we want to retain the water, let's drink more so we can put more water into ourselves. Okay, that's why for certain blood pressure medications, has anyone here ever heard of an ACE inhibitor? Yeah, ACE stands for angiotensinogen converting enzyme. It converts angiotensin 1 into angiotensin 2. So if we block that enzyme, remember that enzymatic cascade, if we cut it, then we can't make angiotensin 2 and we can't increase our blood pressure. We keep it low. Okay? All right. Ooh, my favorite. Not one of my favorites, but the stomach is one of my favorite organs because a lot goes on in there. All right? But the stomach produces and secretes gastrin. Okay? And so gastrin here, all right, is going to it's going to help stimulate, and we'll get into this when we get into the digestive system. It's going to help to stimulate the secretion of some of the other digestive enzymes. And it also increases the motility. So what that means is it's time to move the stuff that's in your stomach out into the small intestine. It happens as soon as you start eating. Right? In fact, if you smell something that's something pleasant, right, your mouth starts to salivate. Well, not only that, your mouth starts to salivate, and then your stomach starts to increase its gastric enzyme production in anticipation of eating. Okay? So gastrin helps with that. Okay?
You want it, I'm gonna make it.
Almost done, you guys. Oh, small intestine. All right? Again, another structure that's going to have some endocrine function with these two hormones, secretin and cholecystokinin, which is also known as CCK. Okay? So they both have some similar roles. No, I wasn't with you guys. Keep in mind, your liver is the organ that makes the bile. All right? And it makes some digestive enzymes. But your gallbladder stores the bile. Okay? So CCK or cholecystokinin is going to stimulate the gallbladder to contract and relax to squeeze out the bile into the small intestine. All right? So what will happen is when food starts to enter into the small intestine from the stomach, all right, the presence of that food will put a stretch on the small intestine wall. We'll talk about this. But again, going back to that reflex, all right, the stimulus, the presence of food there in the small intestine, there's receptors there that pick that up, and then they're going to then cause that secretion of secretin and cholecystokinin, which is going to stimulate the liver, all right, to release some of its digestive enzymes, all right, and bile, and the pancreas to release it's going to release pancreatic amylase and lipase, those two enzymes I was telling you about to help break down food. All right, vitamin D, here we go. This should all be reviewed, okay? Vitamin D, all right, is that now, I'm waiting. I cannot wait. I might even have a party when it happens, but I cannot wait until they stop calling vitamin D vitamin D. All right, it's just a pain in the rear end. You know, it is considered a fat-soluble vitamin because you can build up levels of vitamin D. I had a patient come back, sent them out. They thought that they were vitamin D deficient, so they were taking 10,000 IUs of vitamin D daily, and ended up they were at toxic levels of vitamin D because and this person was outside a lot. And if you have light skin color like I do, all right, I can actually make vitamin D quite effectively. Folks with darker skin color cannot. It's a genetic variant that occurs, and it has to do with, well, the article that I read, it has to do with living, you know, folks with lighter skin color, you know, generally live further away from the equator. They got less sun. So because they got less sun, they had to be able to synthesize more vitamin D much more effectively. Folks that live closer to the equator, had darker skin color, they, you know, are always in the sun, easier to make, not easier to make, but they didn't have to make as much vitamin D. Anyways, point being, this person was outside all the time, darker skin tone, and they were supplementing vitamin D, and they were up at quite toxic levels that a lot of their symptoms were manifested because of that vitamin D toxicity, right? I don't know what brought me out on that. I'm sorry, I apologize. But vitamin D is synthesized in your skin. Keep that in mind, all right? It creates cholecalciferol. That's an inactive form of it. It enters into the blood, travels through the blood, winds up here in the liver, okay? And then 10,000, yes, believe it or not. No, well, 10,000, Kaylee, that's 10,000 IUs daily. They were told, and I don't know where they got this idea, they were told that they were deficient, so they were trying to do loading doses of vitamin D to try to boost their levels. For the most part, depends on the form of vitamin D that you take. Yeah, I mean, if you get the shot, if you go to the doctor and they give you a shot, usually that's about 50,000 IUs, but they'll do that a shot like once a week for a couple of weeks to get your vitamin D levels up, then they'll hook you up with a dose to maintain, and that's usually around. Some people will take 5 to 10,000 IUs, but regardless, I recommend. Again, I'm going on a tangent, but this is important. I recommend that, especially now around this time of year, that you all do supplement vitamin D because it helps boost the immune system. All right, you have receptors on a lot of your lymphocytes, all right, in your immune cells for vitamin D, and they help to mount a much more effective immune response. They did a study in France, found out that 17%, which is a pretty decent number, people that got the COVID and had some bad interactions with COVID were vitamin D deficient. And so they found when people started supplementing vitamin D that 17% improved when they were infected with COVID. Just saying. Small study that came out of France last year. Right. Yeah. Yeah. It makes, on average now, a lot of the literature out there says that you should have about 15 to 30 minutes of exposure to the sun to synthesize enough vitamin D. I'm gonna tell you something. How much of my skin is exposed to the sun when I'm dressed like this? All right. Very little, you know, probably less than 10%. So what they should really tell people is at least half of your body needs to be exposed to the sun. All right, shirts, shorts, whatever, t-shirt, whatever, okay? And you need to spend, I tell patients, at least 30 to 45 minutes out there, all right? But it varies. Okay, anyways, so cholecalciferol travels to the liver converts it into calcidiol, all right? And then once it makes it to the kidneys, I've seen this asked on tests before, all right? The kidneys are the organ that activates calcidiol into, or converts it actually, into calcitriol, the active form of vitamin D. What does vitamin D do? All right, its big thing is that it helps with the absorption of calcium from the intestine. All right, it works synergistically, all right, with PTH, parathyroid hormone. It helps to stimulate the release of calcium from bone, and then it also helps to decrease calcium loss in the urine by reducing the amount of calcium being excreted in the urine, okay? All right, last slide. Hooray! All right, adipose tissue, okay? Adipose tissue secretes leptin, all right? Now, leptin has been studied for a while. There's still not enough research done on it, but leptin has been studied, and they have found out that it influences your appetite. And they figured out there's a relationship, okay? The larger composition, the larger the amount of adipose tissue in your body, all right, you'll see, all right, the more leptin that will be released, and vice versa, like it says here. Your lower your body fat, the less leptin will be secreted, thus influencing your appetite, okay? Meaning, all right, less leptin, less of an appetite. More leptin, more of an appetite. See that relationship there? Okay?
How can you be less than How do you get that?
I don't even know. That's a good question.
I want that.
Start eating a diet of stuff that you absolutely abhor, but it's good for you. I don't know if there's anything out there.
Less leptin, less appetite.
Less leptin, less of an appetite, lower body fat composition. Okay? And as you know, and you probably heard this and read some of these facts here about adipose tissue, all right, that excess adipose tissue increases your chance of cancer, right? A lot of that has to do with the more adipose tissue you have, because believe it or not, white blood cells, lymphocytes, will live amongst your adipose tissue. They like to live in a lot of things, all right? People think that your white blood cells are constantly circulating through your lymphatic system and your blood system. It's not. That's a small portion of your lymphatic system. When we get into of your white blood cells, when we get into the immunology here, we'll talk about that. A lot of your white blood cells are hanging out in tissues, and they're just hanging out there, waiting. All right. We saw it with the skin. Remember the dendritic cells, the Langerhans cells? They live in the epidermis, and what's their job? They're the cell that predominantly will fight skin cancer, you know, because they're constantly monitoring the keratinocytes in close proximity. They're also known as an APC, which stands for antigen presenting cell. They're a cool cell. But my point being is your lymphocytes hang out and they live in the tissue, ready to be used. All right. We also see excess adipose tissue will delay puberty in males. All right. And also we've seen the opposite. All right. Anorexia nervosa. All right. Those folks are very, very adipose tissue deficient. There are a lot of types of tissue deficient because they're not eating and their body is cachexic and pretty much wasting away. And so, all right, you do enough of that for a long enough period of time, if the person's a female, they can have a complete cessation of their menstrual cycle altogether. Okay? And that's it. We made it through lab. So not too bad with the number of slides. I would work on studying those and going over those while you have the time over the weekend. We're not having class on Monday, so enjoy the holiday too, to take advantage of it. All right. And then we will reconvene here on Wednesday. Make sure that you sign the attendance sheet before you leave. Folks at home, is there any questions that you may have?